first, I heard about this NTX at the first time. I was introduced by Dr. Tan. He's practicing in Singapore, and he's one of the founder of this device. So I was so excited because these robotic technologies and artificial intelligence, it's been developed, but none of them we hadn't used for our clinical practice, especially for the treatment. So I was so excited, and I was so expected this efficiency for treatment. Actually, it's more useful, than what I thought before, because people think about if they, heard about this, robotic or AI things, it should be, complicated. But turns out it's just a simpler for use, and it's very convenient to use. And I should mention it, later, that the learning curve is, not high as compared to the other, conventional technologies. I think the image for robotic assisted surgery is maybe it's more complicated, maybe it's more expensive, and probably some people just cannot rely on those, techniques, which, the surgeries which performed by robots. But the reality is, the robot just assists our procedure. So the surgeon, we can better perform our surgery using this robotic technology. So this is, the part of robotic assisted surgery. I have performed, for example, robotic assisted radical prostatectomy for a while, and the technology is supporting, we surgeons to perform surgeries, more efficiently or maybe safer than others. So it helps our, treatment, and maybe the results showing the robotic assisted surgery has much more benefit or the efficiency for our treatment compared to manually procedures. The technique is not just for patients, but for surgeons or other healthcare professionals. So that means we are more comfortable, and it's more convenient to perform surgeries with those NTX device, because we can rely on this technology, and we don't have to worry about any other the complications or complicated steps for specific surgery. My answer here is we don't know yet, because we're performing randomized control trial using this NTX, but we haven't concluded the result yet. But there is a possibility that we can reduce the complication rate of percutaneous nephrotomy, so that patients have better for example, symptoms after surgeries. This particular question is what I have, asked by my patients a lot of times. I mean, for the like a robotic assisted prostatectomy or other surgeries, but our answer is always, you don't have to worry about these robots because robots just help our procedures, and it can provide, more accurate or maybe safer techniques than we do. So we use these technologies to perform our surgeries better. So we surgeons actually perform the surgeries, but not robots.